You ever get that feeling? Like when your eyes are just done. After a long day, maybe things get a little blurry or they feel strained.
Oh, yeah, I know exactly what you mean. It makes you realize that your eyes, just like everything else, go through changes as we get older.
And that's actually what we're diving deep into today. We're talking about eye health, especially for seniors.
Right, how to keep those peepers in tip-top shape as the years go by. We've got some fascinating stuff to share, from everyday habits to understanding those subtle changes in our vision.
We really dug into some interesting articles for this one, all about how what we eat and how we live affects our eyes. And we're here to give you the best, most practical advice, no fluff.
Exactly. We want to give you the knowledge to take charge of your eye health. What's normal aging? What might be a sign to see the doctor? We'll cover it all.
So where do we even begin with all of this?
Well, why don't we start with some of those vision changes you might be noticing? One of the most common ones is presbyopia. It often starts in your 40s, and it's basically the lens inside your eye losing some of its flexibility.
Presbyopia. Yeah, I've heard of that.
And get this, by age 65, almost everyone has some degree of presbyopia. It can really affect those close-up tasks we do every day.
65. Wow, well, I guess that explains why I suddenly need to hold things at arm's length to read them.
Exactly. It's because that lens can't change shape as easily to focus up close. You might find yourself holding your phone further away, or your vision blurs when you read. Some people even get tired eyes or headaches after doing close-up work for a while.
Well, definitely. I've noticed that.
Yeah.
So presbyopia. What other changes are there?
Another common one is a reduced sensitivity to light. You might start needing more light to see clearly.
Yeah, for sure.
It happens because as we age, the pupil, which controls the light coming in, gets a bit smaller. Plus, the lens and cornea can become a little less clear, which makes the light scatter inside the eye instead of focusing nicely on the retina.
Interesting. So it's not just me thinking I need a brighter lamp. It's actually my eyes.
It's not just you. And you might also notice subtle changes in how you see colors. The lens can develop a slight yellow tint as you get older,
Hmm.
and this can make it a bit harder to tell apart certain colors, especially blues and violets. It's often very gradual, so you might not even realize it's happening.
I hadn't thought about that, but it makes sense. What else?
Well, then there's decreased tear production, which is quite common, particularly in older adults.
Dry eyes, right?
Exactly. It's linked to aging and hormonal changes. It can make your eyes feel, well, dry and gritty and just irritated.
I get that, especially when I'm focusing on something for a long time, like a screen. My eyes feel like sandpaper sometimes.
You hear you. And speaking of focusing, reduced night vision is another change a lot of seniors experience. Driving at night can become more difficult because of the glare from headlights, and it takes longer to adjust when you move from a bright room to a dark one.
I definitely feel less confident driving at night these days.
Makes sense. And it's important to be aware of that for safety.
Totally agree. So what else should we be watching out for?
Well, there's also something called reduced contrast sensitivity. Basically, it's how well your eyes can distinguish between different shades of brightness.
So not just how sharp your vision is, but how well you can see details.
You got it. As this decreases, everyday things like navigating stairs, especially if they're carpeted in a similar color, or reading text on a low contrast background, can become more challenging.
Okay, yeah, that's a subtle difference, but I can see how it would be important. Now, before we move on, can we talk about those more serious eye conditions that people often associate with aging?
Of course, things like cataracts, glaucoma, and AMD, which is age-related macular degeneration. Now, these aren't inevitable, but they do become more likely as we get older.
So cataracts is that clouding of the lens, right?
Mm-hmm.
And what about glaucoma?
That's damage to the optic nerve, often from pressure inside the eye, and AMD affects the central part of your retina, the macula.
I imagine early detection is really key with all of those.
Absolutely. Regular eye exams are so important to catch these things early and get the right treatment. That can make a huge difference in protecting your vision.
Okay, so we've talked about some of the challenges, but what can people actually do to keep their eyes healthy?
Exactly. I'm all for taking action. What are some of those practical daily habits that our listeners can start incorporating right away, especially our senior listeners?
Well, first off, let's talk hydration. Your eyes need enough water, just like the rest of your body.
Stay hydrated. Got it.
Aim for about 8 to 10 glasses of water every day. It helps keep your eyes lubricated, which helps with that dryness, and just supports overall eye function.
Simple but important. What about diet? Are there certain things we should be eating to support eye health?
You bet. What you eat can really make a difference. For example, lutein and zeaxanthin are powerful antioxidants found in those dark leafy greens like kale, spinach, and collard greens.
Kale. Yeah, I know that's supposed to be good for you.
It is.
Mhm.
Think of them as internal sunglasses. They help protect against things like AMD and cataracts. Internal sunglasses. That's
Ah.
a great way to put it.
Aim for at least a cup of these greens every day.
Okay, on the shopping list they go. So greens are important. What else?
Omega-3 fatty acids are crucial too, the kind you find in fatty fish like salmon, tuna, mackerel. They're really important for your retina and may help protect against AMD and glaucoma.
The good fats. Got it.
Try to have a couple of servings of fatty fish each week. Vitamin C is important too for the blood vessels in your eyes, and it might even help lower your risk of cataracts.
Vitamin C, so we're talking citrus fruits, right?
Citrus fruits are great, but also berries and bell peppers. And don't forget about vitamin E, which is found in nuts and seeds.
Nuts and seeds. Okay. Are those also good for AMD?
Vitamin E may help slow down the progression of AMD and prevent cataracts as well. And then there's beta carotene, which is important for good night vision.
Beta carotene, that's carrots, right?
Yeah. Yes, carrots, sweet potatoes, those brightly colored orange and yellow vegetables. Basically, having a variety of fruits, vegetables, nuts, and seeds in your diet will give your eyes all sorts of good stuff.
Got it. Eat the rainbow.
Exactly.
Okay, so we've covered food and hydration. Now, let's talk about something that's a big part of life for so many people, especially these days, screen time.
Oh, yes. Screen time. It's unavoidable for most of us. But there's this really simple thing you can do to help with eye strain. It's called the 20-20-20 rule.
I've heard of that. Remind me how it works.
Every 20 minutes you spend looking at a screen, take a break for 20 seconds and look at something at least 20 feet away. It gives your eye muscles a chance to relax.
Makes sense. I know I definitely need to be more intentional about taking breaks. It's so easy to get sucked in.
It really is. Setting a timer can help. And, adjusting the brightness and contrast settings on your screens can make a difference too.
Oh yeah, good point.
And especially in the evenings, think about using blue light filters or glasses. Blue light can interfere with your sleep.
Interesting. Sounds like there's a lot we can do to manage screen time better and minimize its impact on our eyes. What about other ways to protect our eyes in our daily routines? Anything else we should be doing or thinking about?
Don't forget about the sun. Protect your eyes from those UV rays, just like you protect your skin.
Yeah, sunglasses are important.
Wear sunglasses that block 100% of both UVA and UVB rays, even on cloudy days. It helps prevent cataracts and other sun damage.
I'm definitely guilty of forgetting my sunglasses on overcast days, but I'll try to be more mindful of that.
It's worth it. And another thing is blinking. It sounds simple, but we often don't blink enough, especially when we're staring at screens.
Right.
Try to blink regularly, consciously. It keeps your eyes lubricated.
Okay, will do.
And of course, getting enough sleep is essential. 7 to 8 hours of good quality sleep. Your eyes need that time to rest and repair, just like the rest of your body.
No arguments there. Sleep is so important for everything. It sounds like all these things, staying hydrated, eating well, protecting our eyes from the sun, blinking more, they all contribute to our overall well-being, which in turn supports good eye health.
Exactly. It's all connected. Now, are there any things we should avoid doing?
Oh, like eye care don'ts. I'd be interested to hear about those too.
Absolutely. A big one is rubbing your eyes. It might be tempting when they feel itchy, but it can actually damage the delicate skin and tissues around your eyes.
Okay, no rubbing.
And good hygiene is crucial, especially if you wear contacts. Wash your hands thoroughly before touching your eyes or handling your lenses. It's all about preventing infections.
Makes sense. What about eye makeup? Any tips there?
Always remove your eye makeup before bed. Leaving it on can irritate your eyelids and cause inflammation.
Got it. So hygiene and avoiding rubbing. What else?
Make sure you have enough light when you're reading or doing close-up work. And if you do things like DIY projects or play sports, wear protective eyewear. You don't want to risk an eye injury.
Good reminders. Now, is there anything else about our lifestyle choices that can impact eye health?
Well, if you smoke, quitting is honestly one of the best things you can do for your eyes. Smoking really increases the risk of AMD and other serious eye problems.
That's a strong message.
It's important. Now, what about eye exercises? Have you heard about those?
Yeah, I have. Do they actually work?
Well, they won't cure eye conditions, but they can help improve flexibility in your eye muscles and reduce strain. And that can be especially helpful as we age. One really simple exercise is called palming.
Balming.
Yeah, you just rub your hands together to warm them up and then place them gently over your closed eyes, blocking out all the light.
Sounds relaxing.
It is. Hold them there for a minute or two. It can really relieve tension, especially after you've been using a screen or reading. Another good one is focus shifting.
Focus shifting. Okay, tell me more.
Hold your thumb or a pen about 10 inches from your face, focus on it for a few seconds, then shift your focus to something further away, at least 20 feet away.
Okay.
Repeat that 5 to 10 times. It helps with those muscles that control your eye's ability to change focus.
So that's especially good for combating that presbyopia we were talking about earlier.
Exactly. And then there's eye rolling. Just gently roll your eyes in a circle, clockwise and counterclockwise, about 5 times each way. It helps with flexibility and circulation in the eye muscles.
Got it. Slow and steady wins the race.
Exactly. Remember to do these exercises in a relaxed setting. A few minutes a day can really help.
Okay, so consistency is key.
Yes. And stop if you feel any pain or discomfort. And if you have any eye conditions, talk to your eye doctor before you start any new exercises.
Safety first. Good advice. Now, shifting gears a bit, let's talk specifically about those early warning signs that seniors should be particularly aware of when it comes to their vision. What are some of the red flags that should never be ignored?
That's a really important point. You should definitely see an eye doctor right away if you notice any sudden blurriness, hazy vision, or if colors seem less bright or vibrant.
Okay, so any sudden changes in vision.
Exactly. Also, if you have trouble recognizing faces, especially at a distance, or if it's getting harder to see things out of the corner of your eye.
So those are all visual changes. What about other things like difficulty doing certain tasks?
Well, if you find yourself squinting more often to see things up close, or having more trouble reading small print or recognizing faces, those could be warning signs.
I guess we take those abilities for granted.
We do. And difficulty driving, especially at night, or having trouble adjusting to changes in light, like going from a dark room into bright sunlight, are also worth paying attention to.
It sounds like it's not just about how well you see on an eye chart, but also how your eyes function in everyday life.
That's right. And don't forget about physical symptoms. Watery or cloudy eyes, sore or dry eyes, frequent headaches, or any sudden eye pain, redness, or nausea. Those could be signs of a problem, maybe even something serious like glaucoma.
Glaucoma, yeah, that's one of the scarier ones.
It is. So don't hesitate to see a doctor if you have those symptoms. And here are a few other warning signs to watch out for. Big changes in your vision, like if it fluctuates a lot, that could be a sign of diabetes or high blood pressure. Also, losing your side vision, which can happen with glaucoma, and seeing a blurry spot or an empty area in the center of your vision, which could indicate AMD.
So many things to watch out for.
And one more, a sudden increase in floaters, those little things that drift across your vision, especially if you also see flashing lights, that could mean there's a tear in your retina.
Yikes, that sounds serious. So what's the bottom line here for our listeners?
Don't ignore any sudden changes in your vision, especially if it's something new or dramatic. Some changes are normal with aging, but any sudden shifts or new symptoms should be checked out by an eye doctor as soon as possible.
I'm hearing don't wait, loud and clear.
Exactly, and regular eye exams are crucial, especially as you get older. Those exams can catch problems early on before you even notice any symptoms. And early treatment can make all the difference in preserving your vision. So if you see any of these warning signs, please don't wait for your next appointment. Go see your eye doctor right away.
Great advice. I think it's worth emphasizing just how important regular checkups are.
They really are.
All right, so let's do a quick recap of our deep dive today, focusing especially on our senior listeners. We've covered common age-related vision changes, like presbyopia, reduced light sensitivity, and changes in color perception. We talked about all those things you can do every day to support your eye health. Staying hydrated, eating a nutritious diet, protecting your eyes from the sun, and even simple things like blinking more.
And of course, we talked about those crucial warning signs that should never be ignored and require immediate attention from an eye care professional.
Exactly. It's all about taking those small but consistent steps and paying attention to what your body is telling you.
You know, by doing those things, you can make a real difference in maintaining your eye health and your overall quality of life.
It's about enjoying life to the fullest, right?
Exactly. And your vision plays such a big part in that. It lets you experience and appreciate the world around you.
Absolutely. And on that note, here's a final thought for you all to consider. Think back to those warning signs we discussed today. What's one proactive step you can commit to taking this week to really prioritize your eye health?
Maybe it's finally making that appointment for an eye exam.
Or maybe it's adding more of those eye-friendly foods to your grocery list.
Whatever it is, be mindful of your vision and don't hesitate to reach out to a professional if you have any concerns.
It's a gift to be able to see the world, and taking care of your eyes is one of the most valuable things you can do for yourself.
It really is.
That's all for today's deep dive. We'll see you next time.
See you then.